For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hello, and thank you for joining us today. 3 weeks ago, the County of Santa Clara, in partnership with a coalition of community-based organizations, launched the Community Health and Business Engagement Team Initiative, spearheaded by President Chavez and led by our Public Health Department and the Office of Labor Standards Enforcement. Today we're going to tell you more about our work and what that means to the community. I just want to let everybody know first that all of our speakers will be keeping their face coverings on. We are outside, but under an awning, and there's a lot of people here who's all properly socially distanced, so we're going to be keeping our face coverings on today. The Community Health and Business Engagement Team, also known as CHBET, is an urgent and vital endeavor in our fight against COVID-19. Since the launch, we have ramped up, refined, and expanded our operations to meet need where it is. In the community, in places of work and business, and at your front door with proper social distancing. The program partners with our community-based organizations to reach the most vulnerable communities who have experienced disproportionate rates of this virus. You will hear from our county leadership and partners today about what this means to us as a community, to our efforts to slow the spread of COVID-19, and what everyone can expect when our teams are in your area. There will be time for Q&A at the end, followed by media availability with each of our speakers. We do have public information officers here today with language capacity in English, Spanish, Vietnamese, Mandarin, and Tagalog. And at this time, it is my honor to introduce our next speaker, President of the Board of Supervisors, Cynthia Commoners.
Good morning, everyone. And my mask is a little bit thick in honor of Ruth Bader Ginsburg, our justice. So that's what you're seeing on my face today. So first of all, let me just say that here in Santa Clara County and across the country, thousands of people are able to ride through COVID-19 and the virus, staying safely at home and being able to telework. And we want to thank them for continuing to act in a safe manner. But for many, many people in our community, they are essential workers. They don't have regular jobs, and they need to be able to go out into the community. What that left us with was an increase in people getting COVID-19 who live in in areas that need a lot of support from the community. Examples of that, the east side of San Jose and Gilroy. Even though our teams, and I want to say this very sincerely in Santa Clara County, we're doing everything we could relative to social media, getting information out in multilingual fashion, focusing on the press, really engaging all of you to get the word out, we still had challenges in these very high-need communities. Because of that, myself and my colleagues on the Board of Supervisors, in collaboration with our nonprofit partners, really started to understand that when you're doing everything and you still don't see the cases dropping, you have to do more and you have to do something more innovative. And we didn't have to think long and hard about how to do that because we'd already had experience here using a promotoris model to have leaders in the community educate others in the community about what to do with everything from mammographies to when you have a newborn and how to be able to support that child. So the Board of Supervisors invested $1.5 million in being able to advance this with our nonprofit partners to look at new ways to do outreach and recognizing that for many people in our community, the very best way to do that is in a socially distanced manner, but face-to-face, or through a trusted nonprofit partner that already knows the family. What this has allowed us to do is have these leaders distribute face coverings, hand sanitizers, disinfectant wipes, door hangers, postcards, magnets, stickers, to get the word out so that we can educate people about where to get tested and how to keep themselves and their families safe. Their job is to dispel myths that become truth if in the world long enough. So this is really our opportunity to take our most trusted partners and have them help us, help build awareness, and help build safety in our communities. They're conducting outreach to small businesses in each community and educating them about how to comply with the health orders and connecting them to resources. I want to say a very special thank you to a few of our nonprofit partners, and while there are many, let me start by thanking Working Partnerships USA and the Fair Workplace Collaborative, the Day Worker Center of Mountain View, Step Forward Foundation, Filipino Association of Workers and Immigrants, Vietnamese American Roundtable, the Enterprise Foundation, and the Latino Business Council of Silicon Valley. The CHBET Collective, Somos Mayfair, Amigos de Guadalupe, Grail Family Services, the School of Arts and Culture, and Vegelution. The Community Health Partnership, the Roots Clinic Collaborative, the African American Community Services Agency, UGMA, Unity Care, and the Roots Clinic. And let me just wrap up by making this observation. I had a reporter ask me, well, where did the idea come from? And the truth of the matter is, these ideas came from lots of people, nonprofit leaders, community leaders. But I want to just say that when COVID-19 hit, a leader in our community by the name of Isabel Duran, who'd run a program that was really focused on making sure we had services for cancer victims who were Spanish speaking, reminded me that sometimes as we're moving forward, the best thing we can do is look backwards to see what worked. And I want to thank these nonprofit leaders for bringing their credibility and their skill set in partnership with the very skilled team we have working in our public health department and in our communications department. And with that, it is my great pleasure to introduce Dr. Sarah Cody.
Well, thank you all for being here in the heart of the East Side on a beautiful day where the sky is actually blue. I was driving over and thinking I never thought I would draw so much pleasure and joy from clean air. So very grateful for the clean air that we have today, and let's enjoy it while it's here. So I was just thinking about this business and community engagement team that has risen out of our need to protect people during COVID. But this team and this work is only possible because of the partnerships and trust that we've built over the years, working in partnership with community. Right here, we are in front of where a little tiny piece of our public health department now lives, part of our Healthy Communities branch in Public Health Nursing Services. And that's because we finally came to the realization that in order to be most helpful to community, we needed to live in community and work with community. And so because of those partnerships that we've built, we're able to continue really the public health way of working, which is to be in service to community and work alongside community to be most helpful. We know that here in East San Jose, this community has suffered disproportionately from COVID. People have lost family members, people have lost cherished members of the community, and the rates of infection here have been higher than they have been in other places in our county. And we know that members of this community have had to make extraordinarily difficult trade-offs between their health and their work and how they will support and nourish their family. And we know that there are many reasons why COVID may be spreading a bit more easily here than in other communities, but the question is why, and what can we do to help? What can we do to help protect people? So the work that all of our partners, most and many of whom are here today, are doing is really critical to helping all of us better understand the why and what we can do. And it ranges from everything to getting information from trusted leaders, to having access access to testing where and when you need it, as well as to having access to resources that you need to protect yourself and your family, like childcare or groceries or help paying the rent. So we're supporting, the county is providing financial support and partnering with community organizations to enable community leaders to do what they know is best for their own communities. So we are really pleased to say that the rates of infection here in this community on the east side are decreasing over the last month quite dramatically, which is fantastic. The positivity rates here are also declining, which is fantastic. And that's really a testament to all of you and all of the community leaders and the work and commitment and just sheer grit that everyone has had over the last several months. So I just wanted to close by saying that we are committed to continuing to work with community, and we thank you deeply for your trust in us and allowing us to work alongside you to best protect people. Thank you so much, and I think I'm now going to hand it back over to David Campos.
Thank you very much, Dr. Cody, and thank you, President Chavez. I'm going to say a few words in Spanish, but before I do that, let me just say a couple of things. First of all, my name is David Campos. I am a Deputy County Executive and proud to serve as a co-lead Public Information Officer for the Emergency Operations Center. Our County Executive, Jeff Smith, Dr. Jeff Smith, could not be here, but he wanted to send a very clear message that we're very proud of the actions taken by our board to invest more than $1 million, $1.5 million, as President Chavez said, to make sure that the hardest hit communities, the hardest hit by COVID-19, that they have all the tools they need to protect themselves. As a county, we are proud of that investment, and we know that it's not just about telling people what we think they should do, but actually having people from these communities being a part of that conversation, that it means a great deal to these communities when you have community-based organizations and community leaders speaking to them. So to them, on behalf of Jeff Smith, thank you very much for partnering with the county. And we are proud to see the numbers drop, as Dr. Cody noted. Mi nombre es David Campos y hoy simplemente quisiera decir unas palabras en español. Primeramente, de parte del Ejecutivo del Condado, el Dr. Jeff Smith, un agradecimiento a los líderes comunitarios que están trabajando con el Condado de Santa Clara. Y el propósito de esta conferencia de prensa es simplemente demostrar a la comunidad latina y a toda la comunidad del este de San José y del sur del condado, que este condado está invirtiendo en esta comunidad. Desde el principio de esta pandemia hemos reconocido que la comunidad latina ha sido impactada tal vez más que cualquier otra comunidad. Y desde el principio de esta pandemia el condado se ha enfocado en darle más recursos a esta comunidad para proteger cada miembro de esta comunidad. Y de lo que estamos hablando es una inversión de más de $1 millón, $1,5 millones, trabajando con organizaciones comunitarias, líderes de miembros de la comunidad que nos están ayudando a educar y a informar a esta comunidad. Y estamos viendo que sí están teniendo resultados. Como dijo la doctora Sarah Cody, vemos el número de casos, el porcentaje de infección que ha estado bajando en esta comunidad y estamos muy agradecidos. Sabemos que eso es parte de la inversión que hemos hecho, pero también le queremos agradecer a los miembros de esta comunidad por sus sacrificios y por la fe y la confianza que tienen en el condado de Santa Clara. Muchísimas gracias. So I'll turn it back over to you, Betty.
Hi everyone, at this time we're going to start inviting our community partners to the mic to tell more about their work and what our community members can expect to see when our teams come into the community. So first up, we're going to have our business engagement team community partners. And the business engagement team, and the plan for outreach there was created on a community engagement framework that was already in place with the Office of Labor Standards Enforcement and the Fair Workplace Collaborative, a coalition of 7 community-based organizations specializing in small business education and outreach. So at this time, I'd like to invite Maria Noel Fernandez of Working Partnerships USA to come to the podium.
Good morning. Again, I'm Maria Noel Fernandez with Working Partnerships USA, and I'd like to first say thank you to the County of Santa Clara for their leadership and partnership. I'm proud to be joined by members of our Community Health Business Engagement team who have been on the ground in our communities, working day in and day out at small businesses across the County of Santa Clara to keep workers and customers as safe and healthy as possible. Now, whether you're a restaurant owner, a grocery store, nail salon owner, worker, or a customer, we all share the same interest. We all want to know what we can do to keep ourselves and others safe in this moment. And that's exactly what our team has been doing every single day. We have a team who, some of them are here with us today. We have a team of 24 community outreach workers in various languages, knocking on small business doors to ensure businesses understand the public health order, educate and explain what roles and responsibilities they have, and ensure workers know what resources are available to them. We are here to serve our communities. We're here to provide tools and ensure businesses can continue to reopen safely, protect its workers, and protect its customers. We believe in a full and fair recovery from this pandemic really is only possible if it includes all of us, and ensuring our small businesses have the education necessary on their role as employers and responsibilities to its workers and customers is critical to all of our well-being. We are proud to partner on this, and we have one message for businesses and workers that see us at their doors. We are here to help. We are here for you. And I want to turn it over to one of our outreach team members to share what to expect. You can already see her beautiful shirt, her bag. She's got a ton of materials in her bag, and she's going to show you so you know when she's at your door what to expect.
Thank you. Hello everyone, my name is Cynthia. I'm a community Santa Clara County business engagement team. I'm part of that team. So we are here to help businesses and their workers. I currently reside in San Jose for the past 5 years. What got me to this position was the opportunity to work closely with our community and helping people stay safe. So in order for us to get into the new normal, it's very important for us to be able to help businesses in our community understand what the public health order is. And so what we help them with is how to submit and follow the social distancing protocol, what to do when an employee does test positive for COVID-19, provide information about resources that are available to them, including free COVID-19 testing. So we do carry around these bags. We do have IDs that show our pictures on them as well, so that's something to expect when we are out there in the field. When we do approach these businesses, our goal is just to educate, provide resources, and see if they have questions or any safety concerns regarding anything that we go over. It's very rewarding when we're out there in the field to see employees taking advantage of these resources that we give them. How convenient testing is, that it's free, that there's pop-up sites, they don't need health insurance. For some of them, they can walk in, they don't have to make an appointment. And so those are things that people really like to see. We like to see how they're impacted and how they feel really relieved being able to talk to somebody about what they don't have, they need more resources. We provide people with floor markings. Those are things that we carry around in our bags with us. We carry masks for those who may not have it. We provide funding alternatives because a lot of businesses are impacted by what's going on. And we like to follow up with a lot of these businesses to see did they reach the resources that they needed. Are they getting their questions answered? if you do see us out there in our community, feel free to come up to us and ask us questions. We are there for you, and we look forward to seeing you all. Thank you so much. So that was our partners and community to really outreach to businesses and workers. We do have a parallel operation that works in conjunction under the CHBET banner that specializes in community outreach, residential outreach. These are the folks in your neighborhoods, on your blocks. These are led by, this effort is led by community-based organizations that are going to be very familiar to everyone watching today. They've been around for a very long time, doing this work for a very long time as a part of their core set of values in serving community. And this is really built on a promotoris model that has been a long-standing tradition of the Public Health Department and which continues to flourish under the leadership of Dr. Sarah Cody. So we're very proud of these efforts and are very honored to have our community partners with us today. Our first speaker, representing our community engagement outreach and initiative, is Cynthia Commoners. She is from Vegelution and represents the CHBET Collective today. She'll tell you more about the operation.
Hi, good morning. My name is Cynthia Commoners, and I'm an inside-ground fellow with Vegelution, and I'm also a community health warrior with the CHBET Collective. The collective is made up of up to 5 place-based organizations, all of them non-profit: Amigos de Guadalupe, Grail Farming Services, the School of Arts and Culture at the Mexican Heritage Plaza, and Vegelution. My personal story is something that I want to share with you. During our promotora training, one of the community leaders shared a story of how a friend of hers tested positive for COVID, but without symptoms. She thought that she could go back to work. She was given information, but she wasn't sure until she heard from this community leader that she knew and trusted her. So she needed to stay at home. She realized that all the responsibility she had in her hands. So now she took action. She stayed at home, safe, and trying to save older people. We want to focus on solutions that come with the community in our life experience to help each other, to help our community with kindness and compassion. This work is essential for the health and safety for our community. According to Santa Clara County COVID-19 testing officer, East San Jose and portions of South San Jose have the highest positivity. Testing positive rates have been dropping slowly, but said these site residents remain disproportionately infected with coronavirus. The CHBET Collective has put a team of training promotoras, or we like to call ourselves Guerreros de Salud contra el COVID Comunitario. Together, our 5 organizations work in concert and active networks to ensure our strategies, approach, and messaging efforts and rooted in a community where resilient families have confidence and trust. We are honored to work with Santa Clara County and the Public Health Department. The work that we have doing as collective together is about saving lives. This work is about bringing our 5 organizations together with the support of the country and the county to make sure our community gets the resources they need because they are essential and the vibrancy of this country. So I'm really blessed to be part of this program, Guerreras contra COVID, the collective, CHBET, in Santa Clara County. Thank you.
Of our community health and business engagement team initiative is our presence in our community clinics. So our outreach workers are also in the community clinics, leveraging the trusted relationships and the long-time tradition of service to our communities. So today we have Julia Barba, Deputy Director of Community Programs for the Community Health Partnership, to share more about that.
have educated over 25,400 community members, and have reached over 390,000 over radio, television, and social media. Our community health centers continue to play a major role in reducing the rate of COVID-19 through this program. It is only through the linguistically and culturally sensitive, community-based approaches, such as the ones highlighted here today, that we will be able to reduce the rate of COVID-19 in our county's hardest hit districts. I would like to invite you to continue to join us in the Get Out and Test campaign by calling 408-579-6020. Today also with me, I also have Lupe Yafiz, a COVID-19 health educator. She's available also to answer questions and provide additional information in Spanish. Thank you.
Our last speaker, certainly not least, is Milan Valentin, Executive Director of the African American Community Service Agency, to speak on their efforts to address the disproportionate impact of COVID-19 on our African American and African ancestry communities. Milan?
Hello everybody, my name is Milan Valentin. I am the Executive Director of the African American Community Service Agency, and I'm speaking today on behalf of Alma Burrell, who is the Associate Director of Roots Community Health Clinic, as well as Yvonne Maxwell of Ujima Family and Adult Services, and Andre Chapman of Unity Care. Our collective is working together to empower and educate and provide PPE to the African American, African ancestry, and Black community in Santa Clara County. The question that we have to ask ourselves is, are we going to allow a virus, which we cannot see with our natural eyes, win? Or are we going to beat the virus together as a people? We side with the people, and we are in the community passing out masks, gloves, hand sanitizer, and love as well. We are making sure that we check on our senior citizens in our community that are currently isolated. We have several community workers on college campuses at San Jose State University and Santa Clara University. We are also partnering with the historically Black fraternity sorority, which I am a member of Kappa Alpha Psi, founded in 1911. We are utilizing our resources. Many will say, well, the African American community is less than 3% of the population. That's still a lot of people. And we know that the African American community and the Black community is showing high statistical rates on getting this virus that's dying from it. So we need to pay attention. We need to invest. And therefore, we thank the County of Santa Clara for being a leader in making sure that you're pulling your community partners, making sure that all of us as community nonprofits work together. So we are doing the work. You can come down to the AACSA any day between our working hours and sometimes our non-working hours to get what you need so you can survive this virus and we can move on together. Thank you.
Thank you, everyone. That concludes the presentation portion of our press conference today. My name is Betty Young. I am a lead public information officer with the County of Santa Clara. We will now move into Q&A. So I will help moderate. Oh, yes. And then one more. We have David Campos, please.
My apologies. We wanted to take this opportunity. As you can see, I'm wearing my Census 2020 face covering. And you can see here Monica Tong, who actually has been, along with Nick Kuwata and Miguel Santiago, spearheading the census outreach. So you can see our census workers will be wearing this t-shirt. And we have about 7 days left in the census. And the response rate in some parts of the county, like East San Jose, South County, is not as high as it could be. So we have about a week to make sure that everyone who hasn't responded to the census responds. And we are, again, proud and thankful to President Thomas, who spearheaded the effort to add more resources to that effort. So if you haven't filled out the census, make sure you do, and make sure that you talk to every family member, every one of your neighbors to make sure that they do fill out the census. Thank you very much.
Thank you, David. Thank you, Monica. So yes, COVID-19, community health engagement, census, flu shots, and don't forget to register to vote. Now, we're going to open up for question and answers. Where is that good? Oh, here we go.
Yeah, with so many
address businesses that have to make the decision point between staying in business and also possibly skirting some of the rules or laws because it's just really overwhelming for them right now. I can help answer that, and I can see Maria Noel, if she's still in the audience, if she wants to add. Oh, there you go. Hey, do you want to add anything? But that's exactly the scenario that you just presented is exactly the reason why we have a business engagement team. We want to be able to facilitate compliance in a way that is proactive, that is easy. Our directives were carefully designed in place to balance these priorities, but with the main goal of making sure that all workers, business owners, and customers are safe going into the business, because life must go on. And this is going to be how we keep it going, making sure that everyone is in compliance, following the same protocols to protect their health, the workers that they interact with, and the families and communities that they come home to. So we come out on site to provide education. We do not fine, we do not penalize. This team does not do any of that. If they observe a potential violation, they will not report it. They will address it with the business owner. Take an education first approach and figure out what resources can I bring back here next time to help you comply and continue operating safely. This is a mission to keep businesses open, to keep our communities safe. Maria Noel, would you like to add anything to that?
Just to say that what we're hearing from our outreach workers every single day is that time and time again, businesses want this information. Businesses want to work with our outreach workers, are opening their doors and are welcoming this information so that they can continue to get back to work and do it in a safe way. And so the business team is working very closely with all these small business owners, and we want to continue to see this incredible partnership with folks on the ground.
Thank you. Next question? We were that good. Oh, yes, right here.
Are we able to ask Dr. Cody?
Of course.
Okay, the question is, why hasn't Santa Clara County allowed indoor dining yet, and when do we expect for that to change?
The question is because not everyone in the audience can hear this. The question is, why has Santa Clara County not allowed indoor dining yet, and what has to change?
Yeah.
Yes. Okay. Dr. Cody?
Thank you. So the question is around indoor dining. So as you know, the county is now in the red tier. The state framework would allow indoor dining. The state framework is a floor for counties, and then counties may make their own judgment about their own communities and determine what's safe. I just will note that in the Bay Area, San Francisco, Santa Clara, and Alameda counties have all decided to just pause on indoor dining, and I'll explain why. When you're dining indoors, you have to take off your face covering. And what we're learning more and more is that COVID is spread a little bit by touching things, but that's not the main way. We're mostly concerned about spread through the air by either droplets that you could see or finer droplets that might waft in the air. So the importance of face coverings that they're all wearing now is critical. And you just can't dine with the face covering on. So any activity that's indoors that requires you to remove your face covering, we're just not comfortable with that yet. I want to say that we are starting to make progress again. We've had a little bit of a scary summer, but our rates are coming down. We just need to be patient. We just need to be patient. We've got to get sort of the level of virus in the community, particularly in places like here on the east side and South County, as low as we can before we start beginning again those activities that are riskier. So that's why. David Campos, mejor de gracias.
La doctora Cody también puede hablar un poco de español, pero la pregunta tenía que ver con por qué el condado no ha permitido que los restaurantes puedan abrir operaciones adentro. Oh, another question? Okay. Bueno, creo que so the question is, why didn't we do this before? Y creo que lo que hemos visto con esta pandemia es que siempre hemos aprendido algo nuevo, ¿no? Desde el principio de la pandemia hemos estado examinando el impacto en diferentes comunidades, y es que es por eso desde el principio comenzamos a comunicar en español. Como usted sabe, hemos tenido una campaña muy robusta en radio, televisión, los medios sociales, tratando de educar más directamente a la comunidad en español desde el principio. Cuando los números continuaron subiendo y no cambiaban, comenzamos a tener más diálogo con la comunidad, y fue que comenzamos este programa. Pero lo que ustedes están viendo aquí en Santa Clara no lo mira en otras partes del área de la bahía, del estado o del país. Una campaña que está directamente enfocada en esta clase de contacto persona a persona con distanciamiento social, y estamos muy orgullosos de eso. Sabemos que si hubiéramos sabido más, pudiéramos tal vez actuar anteriormente, pero actuamos lo más pronto posible basado en la información que teníamos. Bueno, el mensaje es de que nosotros, cada uno de nosotros como miembros de esta comunidad, tenemos el poder de protegernos a uno mismo y a nuestro prójimo. Y estamos yendo a cada negocio, a cada residente, indicándole la forma que ellos pueden protegerse a sí mismos, a sus trabajadores, a sus clientes, a sus familiares, a sus vecinos. Y lo estamos haciendo con miembros de esta comunidad que tienen la fe, el respeto, la confianza de estas personas y estos negocios. Y es por eso estamos orgullosos de tener esta asociación con los líderes de esta comunidad que están ayudándonos en este esfuerzo. El propósito de este esfuerzo es no multas, sino que de educar y de informar.
One more question for Dr. Cody, if possible. Maybe just a message about, good health, being good for business.
Yes, another reason that we are, it's really loud. Just wait for the another reason that we're really focusing on business is we need to help ensure that businesses are safe. We want them both to be safe and for the community to be and feel safe when they come and access services. And so to a large extent, I think that these two things go together. The safer the business is for the community and for the workers, the better and more successful the business will be. There's a lot about COVID, this new virus, that we can't control, but there is a lot that is within our control. And so I think we need to remain humble. We need to continue to learn. We need to change course when we learn something new, and we need to share that information. And that's what this whole initiative is all about, to share the information that we have and to answer the questions of people that we have, to assist all of us in being safer and healthier as we can be.
Dr. Cody, one more question. We're obviously in the middle of the pandemic. I wanted to ask you a little bit about the wildfires and the air quality and the smoke. There's a new study out by Stanford saying that because of the air quality, it has contributed to the deaths of between 1,000 to 3,000 people who had underlying health conditions like respiratory issues
tickets are available for media one-on-one interviews, and we also have our PIO representatives who are language accessible in Spanish, Vietnamese, Mandarin, and Tagalog today for multilingual ethnic media. Thank you so much. Be safe and be well. Don't forget to register to vote and fill out your census. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.